On behalf of the American Heart Association, I would like to welcome you to our final session today, the closing session of the HCM Connection Forum. To access live closed captions, please click on the closed caption button found on your screen. All sessions from the full day will be recorded and available in the coming weeks. It's my pleasure to welcome back Dr. Ankit Bhatia to this session to share some closing thoughts. Dr. Bhatia is an advanced heart failure transplant cardiologist and serves as co-director of the Hypertrophic Cardiomyopathy Clinic at the Christ Hospital in Cincinnati, Ohio. As a reminder, full speaker bios can be found in the event lobby. Dr. Bhatia, the floor is yours.
Awesome. So first off, I want to thank everyone. I think this is a wonderful day. And what I've seen in the last couple of years is a really big surge in the field of hypertrophic cardiomyopathy for better awareness of both treatments and diagnosis. And while there's been a lot of more like pie in the sky style presentations on treatment and management and the bigger picture, what I thought today was especially interesting was the focus on health systems, the focus on practicalities. How can you implement real change in HCM care? And additionally, the focus beyond just the provider to the medically adjacent components of care that are needed, including really outreach to patients and whatnot, I think was a real value. And definitely, I walked away from this with a much better understanding of the components needed for great HCM care. So to highlight the sessions, I want to just briefly touch on all of them overall, because I really think they all had some great value to them. First off, Nancy Robles, I want to thank her so much. She talked about HCM disguise. This is a great mimicker condition. There's a lot of similar conditions that can act and look similarly. And really, I think the big takeaway was be aware of what HCM hallmark features are and have a low threshold for referral or to seek out care if that is the case. You know, as an HCM specialist, there's no problem with the fact that we get some diagnoses that are not HCM coming in. But the more important thing is that we are vigilant and aware of the condition. Next up, myself and my mentor and colleague, Dr. Mazur, talked about the patient, the physician as a patient. I thought it was a great perspective to overview and kind of adds to the value of our care here, knowing that he has that lived experience as a patient. Then the University of Utah team, Dr. Weaver Pinzon, Holly, and Nicole, talked about their team-based approach. And what's really unique about their health system is that they are the only game in town in multiple states, and how they have been able to partner with so many distant healthcare systems to create a standard of care for HCM in that region has been wonderful. And I think we can all take away a lot from that. The panel discussion that we had with all the champions really focused on some of the nuances of care and what we're focusing on now and how much this has changed in the age of myosin inhibitors. And I thought it was a great discussion. I learned a lot from it. Moving on, Dr. Wright then talked about HCM as a form of heart failure. And as a heart failure specialist myself, I can very much relate to this. This is a condition that I think for a long time was just considered a condition of obstruction, but we know it's actually a condition of the myocardium. And really, for patients to achieve optimal outcomes, you can't just focus on obstruction. You have to focus on the diastolic dysfunction and how you're going to help treat all components of their heart failure-like syndromes in order to help make them feel better. I think there's a lot of advances coming in this side of HCM treatment in the coming years as well. Moving on, in the genetic counseling session, we heard from Dr. Azari and Courtney Hanoum on the nuances of genetic counseling and the importance and really the disparity, the sheer lack of genetic testing that is occurring in a condition that has a very high yield of genetic positivity. And I took away and I learned a lot from that. I think the biggest point I learned is that I've got a lot of genotype positive patients that don't have HCM, but for those patients with those gene positive, I can do better in counseling them on how to prevent the development of the condition and the lifestyles that they need. So I really thank Dr. Azari especially for that. And then finally, in our last session, we heard from Dr. Wharton, who's a master clinician HCM, and his patient on their experience as well. And the unique patient journeys is what makes this such a rewarding field. So to take away from today, I want to take away and kind of motivate everyone, regardless of background, to have a call for action. When you have a session like this where you can learn so much about the different components of HCM care, you got to think, hey, what am I going to change about my practice as a provider or as a patient? How am I going to better navigate and be an advocate for myself or others? And that's the one thing that we should just focus on as we leave this session. Thinking more towards the future of HCM is really bright. From a system standpoint, there's just so much greater understanding with these myosin inhibitor medications, mavacamten and aficamten to potentially come in the future. There is so many more treatment options available to patients than there otherwise were, and patients are able to achieve symptom relief in the way that they haven't. But as a result of that growth in interest, I think there's been an interest in better understanding this field and the nuances of care and how to better diagnose it as well. When we think about the future, what comes to the future, I know we have great treatments for obstructive hypertrophic cardiomyopathy. We now have several trials in the works for non-obstructive hypertrophic cardiomyopathy. The Odyssey trial for mavacamten just completed enrollment. We're awaiting results on that. And the Acacia trial for aficamten is currently enrolling. Folks spoke today about early phase 1 gene therapy and the role of potentially reversing this condition based on genetic basis. And so there's more to come. There's definitely a lot of more data needed in that space, but it's an exciting new forefront in the field. And then finally, new molecules. There's new molecules on the horizon beyond the myosin inhibitors that are beginning their initial phase 1 testing as well. So just a lot on the horizon here. And then on the more professional and level here, we've got organizations coming about. We have the HCMA, that's been a great advocacy organization for some time. We have the HCMS, that's becoming a professional organization as well, that's advocating. And then we have AHA, also doing a great job really disseminating best practices. So a lot of professional society interest here. So all in all, this is a great day. Really think about what we can take away from everything. And, closing things out here from the perspective of the Connection Forum, our next stop after today's deliverable is to do another webinar coming up in May. That's going to be focused more on the model sharing on a more formal level. You'll hear from all the champions talk about their models and how we can best emulate them for anybody interested in creating an HCM center or accelerating their care. And there may be more deliverables to come after that. But I want to thank you guys so much, and I'm going to turn it over to Renee.
Thank you so much, Dr. Bhatia, for those thoughtful remarks as we wrap up this day. And it's just been such a thought-provoking, wonderful day, the full HCM Connection Forum. On behalf of the American Heart Association, I'd like to thank all of our HCM champions, all of our speakers, and especially our audience members for taking time out of your busy schedules to join us today, for your engaging questions and participating. At the conclusion of today's event, you will receive a survey about your experience, and we really appreciate your valuable feedback. The HCM Connection Forum will be recorded and available in the coming weeks. Again, thank you for your participation. This concludes the HCM Connection Forum. Have a wonderful afternoon.